Today, in the U.S., the most common preventable chronic disease among children is tooth decay. The 2011 report card issued by the Pew Children's Dental Campaign gave Pennsylvania a D for meeting only 5 of 8 national benchmarks. In 2014, Pennsylvania ranked in the lowest percentiles in the nation for children receiving preventive dental treatment. The challenge to provide better oral health care in Pennsylvania can be focused into 3 categories: limited access to oral health care, inadequate support and leadership, and a lack of knowledge across the community. With over 13 million residents, Pennsylvania is the 6th most populous state in the nation. Although Pennsylvania is predominantly known for its major cities, the vast majority of the state is rural. In fact, rural Pennsylvania is bigger than New Jersey, Massachusetts, New Hampshire, and Vermont combined. In these rural areas, inequitable and limited access to oral health care is a major problem. At the state level, inadequate leadership for support and investment in oral health has made it difficult to overcome the barriers to optimal oral health for all Pennsylvanians, including limited resources for full implementation of our state oral health plan, a disconnect between oral health and overall health, and a lack of strong oral health leadership at the state level have been long-standing roadblocks to oral health growth in Pennsylvania. A lack of knowledge about the importance of oral health care across the community affects both the adoption of good oral care habits and the willingness of Pennsylvanians to seek oral health care for themselves and their children. Similarly, a lack of understanding at the professional level has widened the disconnect between medical and dental providers, resulting in a lack of comprehensive, high-quality services for families and overall increases in the cost for care. Today, in Pennsylvania, in spite of its many challenges, a movement is gaining momentum as 4 organizations have emerged as leaders for oral health. In 2014, with the support of the DentaQuest Foundation, the Pennsylvania Oral Health Collective Impact Initiative was created and began working together toward the shared goal of eradicating dental disease in Pennsylvania. As a unified network, through education, outreach, and policy development, we are advancing the cause of better oral health for all Pennsylvanians. In our first 2 years of working together as a collective initiative, we have made significant progress toward institutionalizing a culture of oral health in Pennsylvania that will sustain our activities, change core beliefs, and guarantee long-lasting impacts. We're turning limited access into improving access. Over the past 5 years, we've seen a 56% increase in the number of federally qualified health center co-located medical dental facilities, and a growth of more than 20 dental sites, resulting in a total of 83 sites across the state. Additionally, we are partnering with the Pennsylvania Office of Rural Health More Care Project to integrate oral health into rural primary care practices. Through this partnership, we are leveraging resources and integrating programs to improve access. The Oral Health Workforce Innovation Summit in November 2016 identified innovative care delivery prototypes through this statewide conversation to help develop a sufficient and effective oral health workforce. The collective has advocated for an expanded role for dental hygienists in the medical office. In the first 6 months of a pilot program in a pediatric medical office, the utilization of a hygienist in the examination room has resulted in a 7% increase in completed dental referrals. We're turning inadequate support into expanding support. We will continue to expand support for oral health in Pennsylvania by networking across existing networks and creating new partnerships. We are expanding the Adult Medicaid Dental Benefit. PCOH developed a stakeholder partnership group to work together to increase the Adult Medicaid Dental Benefit. Together, they developed a policy brief and leveraged partner networks to meet with state agencies and the governor. Through our network partnerships, we obtained funding to develop oral health courses for people with disabilities. We were awarded a $25,000 Dental Lifeline Network grant from the Dental Trade Alliance Foundation to support the development of special needs oral health promotion courses. Elevating oral health as a state priority by empowering our network, oral health is now one of 5 priorities in Pennsylvania's current Pennsylvania Department of Health Innovation Plan and State Health Improvement Plan. We provided input to the Preventive Health and Health Services Block Grant within the Bureau of Health Promotion and Risk Reduction. We developed survey questions to be added to the PA Department of State's licensure renewal survey for dentists and dental hygienists in Pennsylvania, and obtained survey data to inform workforce development. Instead of a lack of knowledge, we are building knowledge. We are expanding oral health literacy for the community. We created educational partnerships with the Pennsylvania Library Association, which resulted in the promotion of our oral health story kits to all libraries across the state. And we've partnered with colleges and universities, providing resources to help students share oral health education with local families. We hosted a dental director's boot camp to improve oral health knowledge and promote medical-dental collaboration. The Dental Director's Boot Camp provided valuable information to 20 community health centers and over 30 dental practice leaders. Participants received a resource kit, which included many items for the dental staff to share with the medical practices to facilitate medical and dental collaboration. By educating care providers, we have expanded our network of oral health advocates across Pennsylvania. In year 2, we expanded our network of oral health educators to include more than 90 physicians, dentists, hygienists, and nurses. With 119 total oral health trainings for care providers in just 9 months, we exceeded our annual goal of 72 trainings by 65%. With these trainings, our collective has improved the oral health literacy of over 6,500 care providers in Pennsylvania. The Pennsylvania Oral Health Collective Impact Initiative will continue to attract and galvanize our key stakeholders and advocates and our public and private partners to the singular mission to vastly improve the state of oral health in Pennsylvania. As we orbit around the mission of oral health for all Pennsylvanians, we will remain interconnected and continue to expand this movement as the network weaver, sparking new collaborations and innovation to achieve systems change. Now in our 3rd year, we will press on to cultivate and grow our statewide network, develop a sustainable funding model, lead state policy development, and grow our educational outreach to support oral health expansion in Pennsylvania. And finally, in 2017, we will transform our Collective Impact Initiative into a 21st century coalition for oral health that can lead, leverage, and align all collective efforts across the state. We invite you to join us in making oral health for all a reality, changing the lives of Pennsylvanians for the better.